Hello, everyone. We all know metformin is one of the most commonly used medications to manage type 2 diabetes. It's often the first line of treatment, effective, affordable, and generally safe. But did you know that in certain medical conditions, the same metformin can actually pose life-threatening risks? Let's look at a real-world case that highlights how the benefit-risk balance of metformin can change dramatically with a patient's health status. Meet Mr. Yusuf, a 60-year-old man who's been living with type 2 diabetes mellitus for many years. Scenario 1. Mr. Yusuf was recently diagnosed with compensated liver cirrhosis. That means his liver is damaged, but still functioning relatively well. Doctors classified it as Child-Pugh Class A, the earliest stage. He's currently on metformin, 500 milligrams, twice a day, and doing well. Now, let's talk about the benefits and risks of metformin. Benefits. Metformin improves insulin sensitivity, keeping blood glucose levels in check. It doesn't cause hypoglycemia on its own. Interestingly, there are even potential hepatoprotective effects in early liver disease. Risks. There is a low risk of lactic acidosis in compensated liver disease. No significant liver dysfunction has developed. Mr. Yusuf is tolerating metformin well. No nausea, no acidosis, and no other adverse effects. Benefit-risk conclusion. The benefits outweigh the risks. Metformin can be cautiously continued with routine monitoring of liver function tests, LFTs, and lactate levels. Scenario 2. Fast forward to June 2025. Things have changed. Mr. Yusuf is now hospitalized with decompensated liver cirrhosis. He presents with ascites, hepatic encephalopathy, and elevated lactate levels. His liver is no longer functioning well. Now it's Child-Pugh Class C, the most severe form. And yet he was still taking metformin at home until admission. So now we ask, should metformin be continued in his case? The answer is no. And here's why. Risks now significantly increase. The dysfunctional liver can no longer clear lactate efficiently. Metformin can now accumulate in the body, raising the risk of a rare but deadly condition called lactic acidosis. Mr. Yusuf is already dealing with metabolic stress and multi-organ risk. Continuing metformin could tip him into irreversible organ failure or even death. The risks clearly outweigh the benefits now. Here's what needs to happen immediately. Stop metformin right away. Switch to insulin or glucose-lowering agents not metabolized by the liver. Monitor lactate levels and watch for signs of lactic acidosis. Work closely with a hepatologist and endocrinologist for long-term diabetes management. Update EMR alerts to automatically flag patients with liver disease when metformin is prescribed. So, what did we learn from Mr. Yusuf's story? In early liver disease, metformin can still be used, with caution. But once liver function decompensates, metformin becomes dangerous. The benefit-risk balance is dynamic, and it must be reassessed regularly, especially in patients with chronic illnesses like liver cirrhosis. Medication safety is not static. It changes with a patient's condition. Let's always ask, is this drug still safe for this patient today? Stay informed, stay safe.